Welcome back to the deep dive. We've been on quite a journey, haven't we? Really exploring how interpretation in psychotherapy has evolved.
We really have.
Yeah, starting from, the classical idea, uncovering unconscious conflicts, making things explicit.
Right, the verbal interpretation as the main tool.
Exactly. And then moving more towards self-psychology, that empathic relational stance, focusing on understanding and responding to core self-object needs.
That shift towards the patient's subjective experience.
Precisely. And today feels like we're reaching the culmination of that whole process.
The capstone, maybe?
I like that. Yeah, the capstone. This deep dive is really the final chapter in our series on interpretation through that self-psychology lens. We're going to synthesize what we've covered.
Pull it all together.
And then really dive into this, transformative idea, the therapist's presence as the ultimate interpretation, especially thinking about, those of you maybe earlier in your careers, figuring out how this all feels in the room.
Exactly. And for this final exploration, we're focusing entirely on one key piece. Renat Bonon's article, The Therapist's Participation in the Space of Need.
Yes.
And it's just brilliant. It's not just concepts. It's a deep, practical reflection on what it actually means to be a therapist.
Okay.
It pushes us beyond just techniques,
Right. So our mission today is to unpack Baron's main ideas, really get our heads around this space of need concept she talks about, and explore how the therapist's participation, not just watching from the sidelines, becomes the core of healing. So yeah, get ready to maybe rethink what interpretation truly means.
And what it asks of us.
Why?
The evolution of interpretation, from knowing to being.
Okay, let's really get into this shift. We've touched on it before, how self-psychology changed the game for interpretation.
Fundamentally.
Moving away from just digging for hidden conflicts,
Right.
towards understanding and, crucially, responding to those core self-object needs. The psychological nutrients people need.
Mirroring, idealization, twinship,
Yeah.
the building blocks.
Yep. Exactly, that feeling seen, finding strength in another, that sense of shared humanity. But Baron, she takes this even further, doesn't she? She really pushes the definition of interpretation.
She absolutely does. Her main point really is that interpretation isn't just a verbal thing, or even primarily intellectual.
Okay.
She talks about moving away from that traditional model. Therapist observes, figures things out, then sort of delivers the interpretation to the patient.
Like handing them a package of insight.
Kind of, yeah. Instead, she says, in these really key moments, often quite regressed moments, the therapist's being their active emotional presence, their attuned participation that becomes the therapeutic action.
Wow. So less about the clever words.
Much less.
Yeah.
And far more about the capacity to just be with the patient in a very specific, profound way, often non-verbally.
So it sounds like we're moving beyond just knowing about the patient's inner world.
Right, analyzing it from the outside.
And stepping into it, being with them in that space. That feels like a huge shift in the therapist's role.
It is.
From detached expert to maybe an embodied companion. Is that too strong?
No, I think that captures it really well. It is a fundamental shift.
Sure.
And that leads us straight into her key concept, the space of need.
Right.
Merchav Hatzarek in Hebrew. And this isn't a cognitive map you can draw out.
Okay.
She describes it as primal, often pre-verbal, a wordless realm of just fundamental longing or deficit, developmental arrests, maybe.
So the really early stuff.
Exactly. Where those essential self-object needs, live mirroring, idealization, twinship, the ones that maybe didn't get met adequately way back when.
Where the earliest wounds might be, before language.
Precisely. Laid down before words could capture them.
Okay, so if you're in this space of need, this raw, wordless place,
Yeah.
it makes total sense that standard interpretations, verbal, reflective ones, might just fall flat or even feel intrusive.
Exactly.
Could explaining things cognitively actually push the patient away from the very feeling they need to experience?
That's precisely the risk Baron highlights. A purely cognitive interpretation, especially if it comes from a detached place, can feel incredibly alienating there.
Yeah.
It might even feel like a repeat of earlier empathic failures, Like those times their basic needs were misunderstood or just ignored.
Like getting a lecture instead of comfort.
Exactly. It just doesn't meet the need.
Yeah.
So Baron argues, to really touch these core needs, the therapist has to move beyond observing.
Into participation.
Into profound participation.
Okay, but this raises a big question, especially I think for clinicians still finding their feet. What does it actually mean to be in the patient's need space. How do you even get there? It doesn't sound like a technique from a manual.
No, definitely not.
It sounds more like a state of being, something you cultivate inside yourself, which sounds, frankly, quite demanding.
It is demanding, no question. But also, I think, incredibly meaningful work. It involves this deep empathic immersion where you, the therapist, allow yourself to be genuinely affected by the patient's felt experience.
Not just understanding it intellectually.
Right. Letting it resonate within you, feeling their wordless pain or longing echo in your own emotional landscape. And this is crucial without losing your own grounding.
Maintaining boundaries.
Absolutely. You shift from being an external observer looking at them to an internal participant being with them.
That takes courage.
It takes emotional courage, yeah, and good self-regulation and ongoing self-reflection. It's about being present, open, but also solid enough to contain that intensity without getting swamped by it.
Oh.
2, participation as interpretation, the Roy vignette.
This really changes how I think about interpretation. So how does this deep participation, this attuned presence, actually become the interpretation? If you're not saying anything analytic, how is anything being interpreted? It feels backwards from how we usually think about it.
Right. But that's the heart of Braun's insight. She argues that in that space of need, the therapist's attuned, containing presence is the missing self-object function. It's not about explaining the need. It's about meeting it. Through your presence, your being there, fully present, empathically connected. That becomes the very experience they lacked early on.
And that experience allows something new to happen.
Exactly. It allows those previously unintegrated, maybe dissociated parts of the self to finally surface, be seen, be held, maybe for the first time. Let's use a clinical vignette to make this really concrete. Imagine a therapist. Let's call him Roy.
Okay.
Roy is sitting with a patient. She seems deeply stuck, caught in this kind of wordless state. Maybe longing, maybe despair. The feeling in the room is just heavy.
You can feel it.
Yeah. In the past, maybe Roy would have tried reflecting, it seems like you're feeling very sad.
Or interpreting the history.
Right, connecting it to her past. But today, something's different in Roy. He feels this profound softening inside himself, a deep resonance with her unspoken pain. Not just understanding it, but feeling this quiet ache, this deep empathy. Almost like a shared emotional field. And instead of trying to find the right words, the right interpretation, he just lets his presence be the response.
He doesn't say anything.
He just breathes with her, sits in that heavy silence.
Yeah.
And truly is with her in that difficult, wordless place. Not trying to fix it, not naming it, just containing it with his being.
And what happens then for the patient? What's the impact of that quiet, shared presence?
Well, later on, maybe the next session, the patient finds some words for it. She says something like, "It felt like you were with me in a place no one's ever been before."
Wow.
It was like you just knew without me saying anything.
Yeah.
And it wasn't scary. I felt held.
So the therapeutic action wasn't the insight Roy gave her.
No, it was the experience she had, being deeply accompanied, contained, in a place that used to feel terrifyingly lonely.
Wow.
For Baron, right there, the interpretation was the participation. It provided that corrective emotional experience.
The missing self-object function.
Performed by Roy's quiet, steady presence, allowing a part of herself to be held, recognized, integrated. That moment where I am with you here becomes the deepest possible insight. 3, ethical implications of presence. Navigating the depths.
That Roy story.
Yeah.
Yeah, that really brings it home. It shows the power of this presence. But, it immediately flags some important questions, especially for therapists starting out.
Definitely.
What are the risks here? What responsibilities come with participating so deeply? How do you make sure this being with is therapeutic and not, intrusive or engulfing or maybe even re-traumatizing? It feels like a very fine line.
It is a very fine line, and that's a crucial point. Baron is very careful about the ethical side of this. The therapist has to maintain this delicate balance. It's absolutely not about fusion, boundaries dissolving, no.
Right.
Or abandoning the professional frame, the structure of therapy. It's about providing a containing self-object experience.
Containing. That feels key.
It is. The therapist's presence isn't meant to be boundless or invasive. It's structured. It's intentional. It lets the patient feel seen, understood, held, without being overwhelmed, without losing their own sense of self, and importantly, without feeling they need to take care of the therapist.
That's important too. Not making it about the therapist's needs.
Critically important.
Yeah.
Because the potential pitfalls are real, especially early on. A therapist might, out of a genuine wish to help, slide into trying to fix the pain.
Or rescue them.
Exactly. Or maybe their own discomfort with the patient's distress leaks in somehow. And suddenly it's subtly about the therapist's experience, not the patient's need.
Which could feel like another abandonment, ironically.
Precisely. A reenactment. So the therapeutic power lies in offering that missing attuned presence while affirming the patient's separateness, fostering their growth.
Not creating dependency.
Not creating dependency or blurring lines. Deep connection while holding the frame. That's why good, consistent supervision is just non-negotiable for this kind of work.
Right. A space to process your own reactions.
Your countertransference, yeah. To make sure you're really holding the patient's needs, not your own stuff.
So, okay, what does this mean for us as clinicians developing our style? It's about cultivating this presence, deeply empathic, but responsibly contained. Being with patients in those vulnerable pre-verbal spaces, not just analyzing from afar. It means our being who we are in the room, our internal state is maybe as powerful or even more powerful than our doing the techniques, the words.
That's a great way to put it.
So for someone just starting out, trying to cultivate this, what's maybe one small, tangible thing they could practice? A shift in how they listen or hold themselves?
That's a wonderful question. Okay, one concrete thing.
Yep.
Practice listening beyond the words.
Okay.
When a patient is struggling, before jumping to reflect or interpret, just notice. What do you feel in your own body? What sensations or images come up? Let yourself be affected, but then consciously bring yourself back to your own center. Feel your feet on the floor, maybe.
Okay.
Another thing is noticing the difference between feeling for the patient. Yeah. Which can sometimes lead to wanting to rescue.
Yeah.
And feeling with them. Empathy, which means staying grounded in your own experience even as you resonate.
Maintaining boundaries while connecting.
Exactly.
Yeah.
So a small shift. Maybe just taking one conscious breath before you respond, creating that tiny internal pause.
To check in with yourself.
Yeah. To be present before you act.
Yeah.
It's like learning to dance. You have to attune to your partner, but you also have to keep your own balance. Outro.
Wow. What an incredible journey we've taken through interpretation. This really feels like a fitting wrap-up to the series.
This does feel that way.
From those traditional views uncovering conflicts, to self-psychology's focus on empathy and needs. And now with Renat Bar-On, this idea that sometimes the most powerful interpretation is just presence, being there.
Yeah. Bar-On's work is such a vital reminder, isn't it? Our words, our insights, they matter. Of course they do. They have their place.
Absolutely.
But often, the real core of the healing work, it lies in our simple capacity to be with another person in their deepest space of need. It just highlights the incredible power of existing attuned and present within that therapeutic relationship, offering that sense of recognition, acceptance, containment. It can be truly profound.
And it's more than just a theoretical shift, isn't it? It feels like a deep call to self-reflection for all of us clinicians.
Exactly.
It challenges us to think not just about what we do in the room, our techniques, our theories, but about who we are, how our internal state, our very presence, actually shapes the encounter.
Asking us to look inward just as much as we look at the patient.
Yeah.
So as you listening, reflect on your own practice, your own journey as a therapist. Maybe ponder this. Beyond your words, beyond your techniques, how does your presence resonate?
Yeah.
Especially in those difficult moments, in that space of need for your patients.
What are you communicating, moment by moment, just by being there?
Yeah. Allowing yourself to be that containing, attuned presence. What does that actually communicate?
Yeah.
Think about those times when words just don't cut it, when explanations feel empty.
And only your presence can speak.
Exactly. What does that presence say?